Ready?
Do you guys want an eye line? Do you want an eye line?
That would be lovely too.
Where should I?
Well, thank you everyone for joining us here today. It's my privilege to host the Honourable Minister for Health, Minister Greg Hunt, and Lucas Toka, First Assistant Secretary of the Department, who's leading the COVID-19 response into the COVID vaccination program. Here we are in beautiful Victorian city, suburb, or Melbourne suburb of Lalor, where we have a high demographic of culturally, linguistically diverse Australians who've built and become part of our practice. So as I said, I'm going to introduce the Minister first, and he'll come up and speak, and then Lucas Toka will speak, and then I'd like to also address very briefly, make some poignant comments. Thank you.
Great. Look, thanks very much to Dr. Tony Bartoni, who is actually one of Australia's great general practice leaders, obviously a former head of the Australian Medical Association, but was co-architect of Australia's telehealth plan. And without Tony, we wouldn't have it. It was your support, it was your guidance during the height of the pandemic, when we were able to make a change which meant that patients were protected, doctors and nurses were protected right through the height of the pandemic and right through the second wave here in Victoria, but which has also become an embedded part of our system. I'm also joined, and Dominic Barbaro, Dr. Dominic Barbaro was the founder of the Lalor Medical Centre, I think coming up soon enough to 50 years, and so that'll be a pretty significant achievement going back to the 1970s. You know, he's been serving our culturally and linguistically diverse community right throughout that time. And we heard most of the consultations today were done in Italian, and it's just great to see the diversity of Australians coming forward to be vaccinated, and in particular Maddie and Nicola, who brought themselves forward to be vaccinated today. I'm also joined by Dr. Lucas Toka, and Lucas is the head of the COVID-19 primary care and vaccination response program within the department. Today I have a very simple announcement, and that is that from deliveries next week, the Australian government will triple the number of doses from 50 to 150 per week for the lower volume general practices, and we will double the number of doses per week from 100 to 200 per week for the medium volume general practices around the country. We always said that as supplies became available, and as we had confidence in those supplies and sufficient contingency, then we would make that available, and that's exactly what we've done. And we've worked with the GPs, and Lucas and his team have done that. We've worked with the suppliers, and we're confident in the supply, and we're now able to do that. And we also thank the states and territories for the fact that many of those have moved more broadly to Pfizer. They're continuing to vaccinate with AstraZeneca, but where they have spare supplies, they've also made that available. So that's much appreciated. Then, in addition to that, in terms of cases, you may be aware that in New South Wales today, one case has been identified. Contact tracing is already underway. We know the strength of the New South Wales system, the absolute global gold standard, and that case will appear in tomorrow's figures. Today, importantly, 0 cases around Australia, 77 days, at the same time as we're seeing over 775,000 cases around the world, and agonisingly over 14,000 lives lost. Almost half of those cases, over 350,000 of those cases, are in India, and we feel for and we support what's happening in terms of the actions that are occurring in India to help with this. As part of that, I'm pleased to be able to announce that within the next 24 hours, the first shipment of Australian medical supplies will be going to India, and that includes, in particular, 1,056 ventilators and 42 oxygen compressors, so 1,056 ventilators and 42 oxygen compressors. This is the first shipment, it's not the last, and we're getting great support from around the states and from the general community on that front. With regards to testing, we've just passed 17 million tests and 53,000 in the last 24 hours, but in New South Wales, obviously, if you are in one of the affected areas, as outlined by the Chief Health Officer there, we would encourage you to come forward for testing. In relation to vaccinations, Lucas will give more detail, but we've now reached almost 2.4 million vaccinations nationally, 2,396,000, 314,000 vaccinations, including over 79,000 vaccinations in the last 24 hours, and that is 858,000 at state level and 1.5 million at Commonwealth level, 1.538 million to be more precise, and that is overwhelmingly led by our GPs. So I'm delighted that we're able to support our GPs today with a tripling of doses to the lower volume general practices. That will give them more capacity as we move into the over 50s phase. We've seen obviously Maddie, who was vaccinated today, in the over 50s phase, and around the country people are coming forward to be vaccinated. We'll continue to urge them to be vaccinated. This supports our GPs with a tripling for the lower dose, a doubling for those who have medium volumes, and it will ensure that we have supplies around the country as we see more and more over 50s coming in. Lucas?
Thank you, Minister. Grazie, Tony and Dominic, for having us here today. So, as the Minister has indicated, out of the doses administered in Australia, nearly just over 1.5 million, 1,538,000 doses have been administered by the Commonwealth vaccination program, including 243,000 doses in age and disability care facilities. But the biggest contributor, as outlined by the Minister, is the primary care system that has now contributed to more than half of all the vaccines that have been administered in Australia, nearly 1.3 million vaccine doses administered by general practitioners, by Aboriginal community control health services, by GP respiratory clinics, and by the registered nurses all around the country who are contributing to this effort. So 1,294,713 doses administered by primary care, and that is across more than 4,600 practices all around Australia. More than 1,500 of those are in the regions, in regional, rural and remote Australia. This is not just an urban rollout. So there's more than 4,300 GPs, 136 Commonwealth vaccination clinics, and 152 Aboriginal community controlled health services that are providing this culturally safe access to First Nations people. As the Minister outlined, we've commenced following the National Cabinet decision, the opening up of the program for those 50 years and over. From Monday this week, state and territory clinics, the Commonwealth vaccination clinics, a number of general practices have opened up so that people 50 years and over can commence to receive the vaccine. From the 17th of May, everyone 50 years and over will be eligible to receive that vaccine, and as a reminder, everyone means everyone, and the vaccines are for free regardless of your visa status or your Medicare eligibility. To facilitate this, we have increased, as the Minister said, the availability of doses in general practices. The idea of this is that the system will have flexibility, so those practices that are capable and have a demand that allows them to increase the vaccinations that they're doing every week can do that, and the practices that are tripling, that are receiving a triple allocation from the deliveries next week are more than 3,000. So we're talking about 3,000 practices that will be able to increase the capacity very significantly, and over 1,000 practices will be able to double the capacity and offer the vaccine to this expanded cohort from the week of the 17th of May. There's just over 700 practices that are currently listed in the Clinic Service Finder that are opened up for people 50 years and over from now, and not waiting until the 17th of May, and that number keeps growing every day. There's more than 4 million people that have access to that eligibility checker, and 2 million people have access to the Clinic Service Finder that you can find on health.gov.au if you go to the Health Department's website. Our final message is that while it's really important that we open up this eligibility to people 50 years and over to continue to accelerate the vaccination program, the absolute priority remains people in phase 1. That is, of course, our quarantine, aged care residents, disability residents, but also anyone 70 years and over, Aboriginal and Torres Strait Islander people 50 years and over, people in critical and high risk and emergency professions, and of course all our healthcare workers, and people with underlying medical conditions, including people with significant disability, and they will remain the priority. But any available doses, any available additional appointments will be made available for people 50 years and over, and these increase of doses will allow for that to happen. Thank you.
Thank you, Minister. Thank you, Lucas. It will not surprise you that when I say that general practice is the backbone of immunisation delivery in this country. We've done it every year for the past number of decades. Last year during the influenza season, we delivered 6 million vaccines in 6 weeks during the peak of that really required roll-up to get that vaccination happening. Part of the 17 million strong vaccination program of influenza vaccines that were delivered in primary care in 3 months. So general practice is really committed very strongly to ensuring that its population of patients, of people that they look after for the various different conditions and ailments, are supported and managed as appropriately and protected against COVID-19. So we were at the table right at the beginning of this year looking at how to ensure the rollout could take place, and it's not surprising that already, so only after about 5 or 6 weeks of beginning that slow stepped phase rollout through general practice, that indeed general practice is already by far by more than half the delivery medium for those vaccines, and we will continue to ensure that we play our part in rolling up our sleeves to ensure that our patients are fully protected. Those doses that the Minister has just announced, the extra doses, will ensure that we continue to even avail more and more of our patients for this very, very safe and very, very important vaccine, which is very important as we continue to see what is happening in many places around the world. Vaccination is another important line of defence. We've done all the hard yards in this country, everything from social distancing, mask wearing, hand washing, cough etiquette. Vaccine is that next important phase. So it's no secret that people want to speak to their doctor when they've got concerns. So in this really very heightened awareness media landscape, where vaccine is being reported daily, patients have got concerns, they've got questions, they want to talk to their doctor. So it makes sense to increase the supply into general practice so that we can do even more about ensuring that that vulnerable group of population, that phase 1B in particular, and of course all the other patients over 50 are fully protected against COVID-19. So vaccine hesitancy and vaccine concerns is what that underlying trust and importance of the relationship between patient and doctor will be really most acutely addressed, and this announcement will go a long way to ensuring that more Australians are going to be protected, and I thank you for that, and thank you again, Minister, for that announcement.
Thanks very much, Tony. I'll start with those on the phone and then come to those outside here. Tamsin?
Thanks, Minister. I'm just wondering about this report in the Australian today that revealed hundreds of breaches in Victoria's hotel quarantine system this year alone, and particularly egregious issues with one member of the senior leadership in that system. What assurances have you received from Victoria today to know that the state is acting upon this and improving the system, and how shocked were you, I guess, to hear that this is happening after the issues that we've seen and the fact that this is supposed to be an entirely overhauled system?
Look, I understand the individual in question has been stood down, and so my observation is that Victoria has taken swift action, and I think where we've had disagreements over the last year, we've always tried to do that publicly and politely, but they've taken swift action, and therefore I think it's important where we agree and support the actions they've taken to underline and to emphasise that. And so we have confidence in the quarantine system right around the country. It's been 99.99% effective in preventing breaches, 100% effective in terms of Howard Springs under the the AUSMAT-led program, but all of the states and territories are doing a good job, and they've taken a pretty swift response today on this front. Josh.
Thank you, Minister. Overnight, US President Joe Biden said the American government was looking at giving incentives for people to get vaccinated, like discounts at sporting games. Is the Australian government considering anything like that to incentivise people to get vaccinated? And on a related one, I realise we're still working on the first stage of vaccination now, but countries like Canada and Israel are locking in long-term deals for next generation vaccines several years into the future. What work is Australia doing on supply deals for vaccines beyond this year?
Sure. So at this stage we're not proposing any incentives per se, other than that the vaccine keeps you safe and it can help save your life and it can help save the life of your mother or grandmother, your father or grandfather, your community. And Australians are stepping forwards, and we really thank them for that. America is at a different point, and so they're obviously dealing with those that might be more hesitant. Our job is to encourage as many people to come forward as possible, and today is actually about giving more opportunity for more people to come forward to be vaccinated earlier. With regards to the long term, we're continuing to take the medical advice. We respectfully don't preempt contracts or agreements before they're signed, but I will say this, we are deeply involved in looking beyond this year at booster or variant strategies, and that is a very important part of our consideration. So an entirely reasonable question. Claire.
Thanks, Minister. The PM today said that the India travel pause was working because cases of COVID in quarantine, like how Springs was coming down, and that meant that once we've gone past May 15, we could have a lot more repatriation flights. Presumably, when we start taking travellers from India again, though, there will be another surge in cases in quarantine. So what exactly will we start now to make that more manageable after May 15? And why would we prepare for that before then?
It's always about caseload, and I think that's the important point to understand, is what we have seen is, of course, 1 in 8, more than 1 in 8 passengers on the most recent flights were testing positive. That's a level beyond anything that we had seen before. And our job is to protect Australia against a third wave. Our job is to protect our health system. And so we have to manage the balance and the caseload. And we're aware, obviously, of the potential for cases, which is precisely why we took the difficult temporary measures, and then in terms of forwards, as the PM says, the pause is working. What we've seen is, on the advice that I have from the border and DFAT authorities, in the last 7 days, over 23,000 arrivals with 80 cases, or a positivity rate across the country of 0.3%. So we have dropped from 13% to 0.3%, 13% to 0.3%. So that's the signal.
Sorry, but if anything being done, which is presumably within a month's time, we could be back up to having 1 in 8 cases on a flight testing positive. Does that mean we have to pause travel again?
Well, I think there are a number of things that are occurring. One, of course, is where you have a challenge, it's very important to address the challenge. Not only have we brought on board the National Resilience Centre in Howard Springs, we are tripling the capacity of Howard Springs, and that's occurring as we speak. Secondly, there are provisions being put in place to assist better testing in country at the point of departure, and I think that's a very important part of it, to make sure that we have that better testing in place. And then thirdly, we're looking at systems capacity right across the country. So all of those things are occurring, but the first job was to bring down that caseload, and when that's a reality, right through the pandemic, we've adapted to and responded to the realities, and we're seeing the pause working. The positivity load has dropped, therefore we're seeing greater capacity provisionally emerging within Howard Springs. At the same time, we're tripling the capabilities of Howard Springs going forward. Tom, AFR.
Thanks, Minister. CSL say they're now delivering 1 million doses a week. Aren't the numbers you announced today relatively
think what you're seeing is that acceleration right now with 79,000 vaccinations in the last 24 hours. With regards to going forwards, it's precisely because we will go from, remember these are first dose distributions and we have to provision for second doses, and somehow that is sometimes lost, so it's an important thing for Lucas and myself to emphasise that we'll go from 330,000 AstraZeneca doses being delivered this week to 450,000 next week, to over 600,000 made available in the following week. But then, of course, in week 17, we're moving to second doses. And so at that point, of course, we'll be doing first and second doses and Pfizer. So all of those elements come together. In terms of the supply, CSL is moving now from 3 to 4 batches. The first week where those 4 batches, although previously they had indicated that may have been available earlier, now we know that the week of May the 17th is when we will receive the first of those 4 batch weeks, which is over the million. There is some chance it may be earlier, but at this stage we're banking on the week of May the 17th. And so that's where the supply comes. But we always have to provision for second doses, and that is absolutely an important part of it. Jonathan.
Thanks very much for your time. Can I ask you, it's almost a year to the day that you stood alongside 25 to about 10 million COVID testing kits from companies going thanks to the mining mandate. Can you update us? Where's that at now?
Ultimately, we ordered and received 4.8 million doses. Just over 3 million have been used so far, and others are continuing to be used. So that was critical. The advice of Helios, one of the providers, is they would not have got through the full testing for Victoria during the second wave here without those supplies. And the world was facing a supply shortage back in April and May of last year, and that has been absolutely vital. So already over 3 million used out of 4.8 million that have been acquired. We've always had the option for more if we need them, but global supplies are now strong, and it's also provided a very important contingency reserve if something else were to be a problem globally. So we have strong supplies globally, but every day, whether it's with regards to masks, vaccines, ventilators, test kits, we're always looking at the risk and making sure there's contingency. So it's been a critical part of our national testing program, and it's helped save lives and protect lives. Chloe.
Thank you, Minister. I was just heard from Ida Musgrove at the National Press Club, and she gave a very passionate address about age-related macular degeneration, and she's calling on the federal government to reject a recommendation to cut the rebate for eye injections. Will the government reject that recommendation, and will you next week's budget to increase access to treatment in the public health system?
So firstly, I thank and respect Ida for her work on macular degeneration. It's been very important. Secondly, we are, through our Indigenous Health Futures mission, expanding access around the country for Indigenous Australians with regards to a single goal, and that is by 2025, ending avoidable Indigenous blindness, and macular degeneration is a critical part of that, so there is investment on that front. Then this is a report to government. There are many reports to government, and it's not one which we have considered and determined yet, so I won't preempt it, but our job is very clear to make sure that every Australian has access to eye care as early as possible. And then I'll start here. I think we've got...
Minister, I'm sorry, can I just jump in there? Can I get your reaction to an application that's been launched recently just moments ago against Green Powers on the biosecurity measure? Do you think, are you confident that your measure can withstand a legal challenge?
Look, I won't comment on specific cases before the courts. More generally, that's asking me to comment on a specific case before the court. I've actually spoken about this earlier on in the week before there was a case, so I'd refer you to those comments. Now that there is a case, the advice I have, as always, is not to comment on a specific case. But I think I made a statement 2 days ago which was crystal clear in relation to that. And we always exercise these with the absolute caution and with the full processes, and that's what we've done right throughout. Now, you've been very patient, those who are here. Louisa?
Overnight, we've seen an Australian cricketer test positive to COVID. If Australian grade Mike Hussey did require medical treatment, would you relax the India ban to bring him home to be treated here, or do you leave him over in India to be cared for by their, collapsing healthcare system?
Well, I think one of the very important things that we've focused on is ensuring all of the discussions have been about making sure that we are only bringing people to Australia who are COVID negative. That has been one of the principles that oppositions, governments, the medical fraternity have been talking about, ensuring that we have pre-flight testing. And that pre-flight testing is to ensure that those who are on the flight are safe and that we are minimising the import of cases into the country. And so obviously the deepest focus and sympathy for anybody who has been tested. My understanding is that the particular circumstances of the IPL are such that they have access to excellent medical care within the IPL bubble, and so our care and our sympathy is with any individual. I wouldn't comment on an individual case, but the national principle has been to ensure that people are treated in the country where they are positive, and within the IPL, as a general rule, my advice is that they have excellent access and excellent quality medical care. Liam?
Minister, Australia is one of the only countries producing vaccines. We don't have very many infections. If you do you think there's a case for us to send some of that local production to India? And a second question, Victoria have been asking to reallocate its max vaccine proportion to GPs. Will you allow them to do that?
In relation to the second question, that's already happened, and that's part of the reason that we are able to make this announcement today. We've got the increased supply, the increased confidence in supply, increased contingency, but also the reallocation from the states, which I acknowledged at the outset. So we do thank them for that, and as we increase from 330 to 450 to approximately 600,000 doses of AstraZeneca a week before we get to up the second doses, all those elements have helped. So they're doing a great job, and we appreciate that. Now then, in relation to international vaccines, we've been a huge sponsor and supporter of international vaccine access. Obviously, we've made 1 million of our doses available for PNG, and we have previously provided approximately 10,000 doses to PNG. I'm able to announce today that another 10,000 doses are travelling to Timor-Leste, and I would leave it for the Foreign Minister as to whether or not there have been any requests from India for vaccines. I apologise, that hasn't come to me if there are. One of the things we do have is capacity with our AstraZeneca, because it's now over 50s in Australia. That does create a flexibility for Australia to provide extra assistance to our friends and neighbours who may be facing vaccine shortage. So it's actually something I've been thinking about in the last 24 hours, exactly that question. So I think it's a good question. We have that capacity with AstraZeneca. I'm just not aware of whether the Foreign Minister or the Prime Minister have received any requests from India. You've been very patient.
I couldn't quite hear what was being asked over the phone, so I just wanted to check that last question over the phone. Was that about the vaccine rolling out?
Yes.
Okay, I'll leave that one. When do you expect the first repatriation flights to depart India for Australia? And have you received advice yet on the caseload level Howard Springs needs to reach before you're comfortable allowing Australians to return from India?
So the two are very related questions. The advice we've received from the Northern Territory is that they are increasingly comfortable with the capabilities and the caseload levels in Howard Springs. That still has more days to run, but we'll be considering that on a continuous basis. I think that's the position that the Prime Minister's already set out, continuous review, but we've received in the last 24 hours advice from the Northern Territory that they are thankful for and appreciative of the pause, but the pause is doing its job. What does that mean? That means that I hope we'll be able to resume repatriation flights from India to Australia, to recommence the air bridge as soon as possible after the 15th of May. We still have to review that, but I think the signs are good, and I think the signs are good for Australians returning. We've got one more question, and then everybody's been very patient. Two questions.
What's your message to other Australians considering closing down borders as a response to the New South Wales case? And secondly, a Qantas flight is bound for India with those medical supplies. Will it be returning to India, or is that a chance to repatriate some of those vulnerable?
Sure. Look, firstly, in relation to the states, I think we saw a very measured response to Western Australia over the weekend. A very measured response from Western Australia and a very measured response to Western Australia. So the Chief Health Officers are all meeting through what's known as the Medical Expert Panel, or the Australian Health Protection Principal Committee today, and they will exchange information. They're well used to managing these situations, so they'll provide their advice. But I think the measured response to Western Australia, from Western Australia and from around the country over the weekend might well provide a model. But they are based, of course, on the case risk in terms of any particular outbreak. And there will be cases, we know that, 77 days of zero Australia-wide, but not every day zero. So of any country in the world, we know how to manage this, and we'll get through this. In terms of India, this is a supply run only, and the reason is because there is that pause on individuals for caseload management. The signs are positive, though, that the cases are coming down, 0.3% positivity, over 20,000 people over the last 7 days. I think that should give confidence and hope to every Australian. Ultimately, our job has been to protect against a third wave. There are difficult decisions, but these are decisions which, whether it's been the decisions on China or the decisions on all of the international borders, or the decisions on external travel or Indigenous communities, have ultimately saved lives and protected lives. How is it that we can have almost a full MCG in Australia whilst so much of the world is in agony? It's because of the decisions we've taken, and we'll make them, but we try to keep them as brief, as temporary and as light as possible. Thank you very much.
Tony, can I ask you a quick question?